Greetings from Malaysia. I would like to thank the organizers of GWAC 2026 and Dr. Eugene Tuishime for the invitation to speak in this conference. In this presentation, I hope to share with you the workforce wellness challenges in Malaysia and the ASIAL peer support after unexpected patient adverse events. Before I start, let me show you where Malaysia is. We are a small country of 34 million people situated at the southernmost tip of mainland Asia, shown in red in the map. Anesthesia and critical care in Malaysia are strictly provided by doctors, that is, anesthesiologists or medical officers. For many years, we have anesthesia medical assistants who provide essential anesthesia care in remote areas in East Malaysia, Borneo Island, with on-site or distant supervision by anesthesiologists. This is gradually being phased out. This is where we are in a bigger map. As of 2023, we have a density of physician anesthesia providers per 100,000 population of 3.32, below the WFAC recommended number of 5. How common is burnout among healthcare providers in Malaysia? Much of the available data were collected during the COVID-19 pandemic, when healthcare workers' mental well-being was particularly strained by the challenges of caring for patients with COVID-19. Cross-sectional survey of clinicians in the anesthesia department of the National Infectious Disease Centre of Malaysia in May 2020 found that 55.3% experienced burnout and 67.1% were at risk of depression. Fast forward to 2024, one might hope the situation has improved. But a study at a large tertiary state hospital, which includes allied healthcare workers and non-anesthesiology physicians, instead shows a higher prevalence of work-related burnout of 85.5%. A large percentage of those affected are in the 25 to 55 age group with moderate to high prevalence. This group represents the majority of our workforce members. Malaysia faces a growing shortage of specialists, non-specialist doctors and nurses. While the causes are multifactorial, a key driver is a vicious cycle. Limited staffing increases workload, leading to burnout and resignations, which further intensifies the burden on those who remain in the public system. Official data from 2024 shows that the number of specialist doctors leaving the public health service increased by 57% in 2023. By field, anesthesiologists were the fourth largest group to resign in 2022 and 2023. The pivotal event for Malaysia's anesthesiology fraternity occurred in March 2024, when the Federal Court in Putrajaya, whose judgments are final, held a private hospital and anesthetist liable for RM4, 5 million in damages, the highest award involving an anesthesiologist for post-tonsillectomy bleeding resulting in hypoxic ischemic encephalopathy. Why was it so devastating? Let's look at the timeline. The case took 14 years from incident to conclusion, during which the anesthesiologists relived the trauma daily, while their reputation was debated in courts and media. The anesthesiologist told me she would not wish her experience on anyone else. This reflects the second victim phenomenon, where healthcare workers involved in an unanticipated adverse event or patient injury are themselves negatively impacted. Unpublished survey data shows over 80% of anesthesiologists in Malaysia have experienced this at some point in their career. In June 2024, based on an expression of interest and prior work, the Malaysian Society of Anesthesiologists and the College of Anesthesiologists, Academy of Medicine of Malaysia, appointed the first ever second victim task force in Malaysia to promote awareness, advocate for and institute ownership of peer support in anesthesiology departments. From June to October 2024, the task force met every 2 weeks at the Medical Academies building in Putrajaya, where our offices are based. At the conclusion of our first meeting, the slide outlined our goals: formulate a structured peer support program, strategize stakeholder buy-in, and implement and maintain the program. None of us grew up with such institutional support, so we must self-educate to lead. we named our initiative Asia Second Victim Program, Anesthesiology Supporting Healthcare Individuals with Empathy, Leadership and Dedication. On the 19th of June 2024, we held our first Zoom meeting with Susan Scott of the University of Missouri, a pioneer of second victim support infrastructure for advice and guidance. Concurrently, we plan educational awareness activities, including lectures at national and regional conferences, articles in society and college newsletters, webinar and social media. August 2024, at our annual scientific conference, attended by all identified stakeholders, we issued an advocacy statement. Notably, we stressed that second victim peer support must be structured, formal, and accessible. In October 2024, we published an original guide on establishing a second victim peer support program for anesthesiology department. Rather than providing direct peer support, the society and college aim to help departments implement and maintain the program at their own level. The guide can be downloaded from the Malaysian Society of Anesthesiologists website. In October 2024, we launched the guidebook and reinforced our advocacy statement during National Anesthesia Day celebrations, in line with the WFSA theme of workforce well-being. In 2025, the Society supported distance learning courses, began designing a local Malaysian peer supporter training course, and collaborated with the Malaysian Society of Clinical Psychologists on areas outside our expertise. On 25 to 26th of April, we held our first Asia Peer Supporter Training Workshop with 32 participants who will subsequently deliver peer support training across 5 regional workshops in Malaysia. The course focused on core competencies, communication and interpersonal skills, emotional support and intervention, ethics, just culture and legal aspects, organization and roles, and self-care and resilience for peer supporters. It brought strong, engaged participation and honest conversation about second victim experiences. The society and college undertake concurrent advocacy under the second victim framework, strengthening medical legal defense, physician education, indemnity guidance, expert witness training, a member assistance hotline, promoting a just patient safety culture with open disclosure policies, and engaging with the judiciary for medical legal reforms, while also embarking on cross-disciplinary collaboration to share their peer support program. Thank you for the opportunity to share Malaysia's experience with anesthesiologists' wellness challenges and solutions. The high prevalence of burnout among our healthcare workers underscores the urgent need to support provider well-being.